Today starts National Women's Health Week, and we want to talk about how women can take care of themselves, especially when it comes to heart health during and after pregnancy. We have Dr. Kardie Tobb here from Cone Health. She's board certified in cardiology, and she can explain what steps all women can take to reduce their risk for heart disease. Thank you for joining us. All right, let's start with this. Some people think of heart disease as just a man's disease. Tell me why that's not true.
Oh, Tanya, thanks for having me here today. It's a pleasure to be here. Heart disease is really not a man's disease. About at least 1 in 3 women would die from heart disease. And if you look at high blood pressure as a whole, half of American adults that have high blood pressure are women. But the good thing is heart disease is preventable. And as we talk today during this conversation, I'll share with you what people can do to help prevent themselves from heart disease.
All right, well, let's talk, because it's all about women's health right this week. So women's bodies, they go through these unique changes during and after pregnancy. So talk a little bit about a woman's risk for heart disease during those specific stages.
Okay, so yes, women's body go through a lot of different phases when they're pregnant, but I want us to look at it in 3 different phases. One, what happens before you get pregnant, what happens during pregnancy, and what happens after. Ideally, we want women to know that they're really planning their pregnancy and talk to their healthcare provider before they get pregnant. If they have high blood pressure, if they are what we call obese with a body mass index greater than 35 or 30, ideally 30. So what happens at that time if you have high blood pressure? We'll be helping you prep your body, look at the medicines that you are going to be on that could harm the baby. So that's the first steps we want women to take during that time. However, if you get pregnant and you haven't done these things, seek care, because if you have high blood pressure, we want to make sure that we can help you control the blood pressure so you don't get those complications that could cause worsening heart disease during the time of your pregnancy or after. There are a few things that I want women to be careful of. Like if you're age 35 and over, check with your provider first. Make sure that you don't have high blood pressure, because a lot of people don't have blood pressure, but they're not being checking themselves. Another thing that I want people who have diabetes, make sure your sugars are controlled, because during pregnancy, those are the things that can increase your cardiovascular outcome, meaning cause more damages to your heart while you're pregnant. That can cause a lot of bad things to happen to you years to come. One other thing I want women to be careful of, because race can be an issue with how people are perceived during the time of pregnancy. And in the United States, the maternal mortality, what I mean by that is women are dying during childbirth or after childbirth is really high. And Black women are 2 times more likely to die during and after pregnancy than white women. So race is another thing. So if you're a Black woman out there who are pregnant or planning to get pregnant, talk to your healthcare provider. Also seek care early, because there are a lot of research studies that are showing that access to care is one of the reasons why Black women are dying more in pregnancy. And another thing, understanding what we call the social determinants of health. How structural racism may be a barrier, meaning that the woman is communicating her problems or communicating her issues and is not being heard. And another study showed that the way Black women will report pain sometimes is not being looked after compared to her white counterparts. So these are the high risk things I want women to be aware of. If you have high blood pressure before pregnancy, please talk to your primary care doctor or your healthcare provider. If you are greater than 35, make sure you're seeking preconception care before you get pregnant. And if you're a Black woman, advocate for yourself. That doesn't mean that you're angry, antagonistic, but be a collaborator. Collaborate with your healthcare provider. Express your views more than 2 or 3 times if you feel you're not being heard, and find another provider if you feel that this provider is not really giving you the time of the day for your health care.
Yeah, we've done stories on that several times, and it's so important. If you feel like something's going on with your body, you need to get someone to listen to you and to hear what you are saying, for sure. All right, we're going to continue this talk because I want to know what we should do to take care of our hearts when we are starting off with a little one, because, you know, moms can experience less sleep and a whole lot more stress, right? So we're going to talk about that as soon as we get back from break. We'll be back in just 2 minutes. Hey, we're back with Dr. Kardie Tobb from Cone Health, and she's talking about women's heart health and what steps they can take to be healthy. And so where we stopped was, all right, what happens if you have a little one, you're experiencing less sleep and more stress while recovering from childbirth? What do they need to know about their heart health?
So the one important thing is if you're on medicine for high blood pressure, we want you to continue taking your medicine. If there are barriers where you have and you can't get your medicines, express that to your healthcare team. They'll find a way to help you. The most important thing is try to get a network system with your family, friends. Take time off for yourself, an hour or two in a week, just to recuperate and get some stress relief. But ideally, stay with your medications, stay with a healthcare plan, and follow up as you are able to.
All right, so Cone Health, they have a whole new heart disease clinic that is going to be open specifically for childbearing women. So kind of talk us through the high points of that.
So we're really excited because our clinic is going to be opening on May 13 in our Med Center for Women building. And this clinic is going to cater to the needs of our local female population. First, those 3 steps I talked about earlier before pregnancy, we want to see you and see what your heart disease risks are. See if you have high blood pressure, diabetes, if you've had heart failure in the past. We want to take care of you during pregnancy. Make sure you're on the right medicines. Make sure you and the baby are fine. And after pregnancy, we want you to stay home and take care of your family and not be coming back in the emergency department because your blood pressure is high. So we want to follow you during that time, hopefully up to a year. But we want to make sure women locally have that lower risk for what we call cardiovascular mortality, meaning dying during or after pregnancy, and make sure our local moms are also healthy as they go through childbearing age.
All right, so let's kind of talk about on the big picture. What are the signs or the symptoms that all women need to be aware of that would indicate to them, you know what, I really need to contact my health provider?
The first thing I tell all women is know where your normal healthy baseline is. What that means is know how you are every day. So if something starts to come up where if it's chest pain or you're just feeling tired, you're having fluttering of your heart, then you're able to contact a healthcare provider. Don't wait until it's worse or it's too late. Contact us early and we're able to help as soon as we can.
I think that for us as women, I know that we pay attention to our bodies, but I think we dismiss things very often. So how do we know when it's something that I really do need to contact someone versus, oh, I just feel like tightness here, or I feel like, you know, there's a bubble of air there, or whatever?
So the first thing is, if you're out of your normal state and you're having that for a day or two, I would make a phone call to my primary care provider, or, you know, ask the woman to make a phone call to a primary care provider for a short time.
Go ahead. I think your Zoom froze for just a minute, but we're back with you, so that's all good. A few technical glitches.
So what I was saying was, don't wait for a long time. If you feel out of your body, you feel like you're not your normal self, and you feel chest pain, shortness of breath, sometimes the symptoms doesn't escalate. It comes for a short time and go away. I really would talk to the healthcare provider about it if I was the female experiencing that, to make sure that I'm not presenting late, because sometimes we wait too late that things happen and we can't change it, the course of it. But I'll say contact early.
Yeah, I think if you would tell your friend to contact the doctor, then you should contact the doctor, right? All right.
Yes, ma'am.
You recently published a paper about the low percentage of women who participate in clinical trials about heart disease, despite it being the #1 killer or a leading killer of women worldwide. So tell us about your findings and why this is like really concerning.
So me and my co-authors did a literature search and published a paper looking at how many women are participating. It's heartbroken because this is the thing that's killing us. The #1 killer of women is heart disease, but 38% of the participants in research study are women. The rest are men. So this is concerning because all the medical advancements, most of the medical advancements that are being used from the literature for men on women, and our bodies are built differently. So that is a concerning fact that we're not even half of the participant in research studies.
Okay, how important is it that women then, so then it really is way important for people to participate in those trials. Are there any plans in the future for clinical trials for women at Cone Health?
So we're looking into different possibilities. We have a study that we're hoping to get grant for to look at women postpartum, meaning after pregnancy, hypertension, and see how we can help locally change the spectrum of that and how social factors can affect that. So hopefully that will be coming in the pipelines.
Okay, and we've got just about 1 minute left. Can you address some of the key concerns about women participating in trials? Maybe we can dispel them.
So few of the things that we discover from the aspect of the women are, the first thing is lack of awareness. A lot of women are not aware that clinical trial is happening and that they can participate in that. I would urge women to encourage other women to ask their primary care provider, their healthcare provider, look on clinicaltrials.gov and see how they can participate and give back. The second thing is a lot of women are not willing to take risk. They're afraid that, oh, if I participate in this study, I'm going to be having some problems. So I would urge women to really talk to the healthcare provider, because we can give you more information about different studies. And when it comes to minority women, it's been historically a trust issue. So we have to educate over time and ease women into these different processes so they understand that it's safe and they're helping with saving lives.
Fantastic. All right. Thank you so much. I hope that dispelled some for folks, so when they see it come up that they do take part. Thank you so much for your time. If you missed any of this information, you can find it in the To Your Wellbeing section of our website.